Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is an opportunity for us to feature our Chamber member businesses, individuals, and organizations that are doing good things around economic development in the region. First, I want to just wish everybody a Merry Christmas, Happy Hanukkah, Happy Holidays, as we have our last segment of the show for 2025. And want to thank the sponsors that make the show happen. That's St. Vincent Hospital and Bank Hometown. And from St. Vincent Hospital, we're really pleased to have with us Dr. Prashant Kumar, who is a pain management physician at St. Vincent's. Doctor, welcome.
Yeah, thank you for having me.
Yeah, so we were chatting a little bit before we kicked off the show. 12 years at St. Vincent.
Yeah, time has flown by. I've been here for a while now.
Yeah, and arrived here after doing, around the country. Or at a hospital in Chicago, down at LSU.
Yep, I was at LSU for my anesthesia residency, and then after that I went to Rush University in Chicago for my subspecialty training in pain medicine.
Yeah, and so the Chicago prepped you a little bit for the New England winters.
It did.
Yeah, so pain management, everybody, especially as they get older or have injuries, maybe when they're younger and recover but have lingering pain. Maybe you could just kind of talk about the kind of scope of your practice and kind of how you work with patients.
So pain management has a pretty wide breadth of conditions that we treat. Everyone comes in with a different sort of issue, different sort of pathology, and so really the way that I start is getting to know the patient, seeing where they're coming from, what their functional goals are, and really just thoroughly assessing them with a history and physical, and seeing number one, what their pain condition is, and number two, what their functional goals are. What do they want to get out of a procedure or treatment? Right.
And you see, procedure, treatment. Just let's talk about the treatment end a little bit. I mean, sometimes it's therapy, maybe physical therapy, occupational therapy, etc. Exercise, stretching, yoga. It could be a lot of those types of things, and then it could also be, prescription. I assume those are the gamuts that you assess.
Yeah, I really use a multimodal approach to treating pain, and what I mean by that is I use a variety of different modalities. I generally will use minimally invasive procedures, medication management with various classes of medications, as well as working with other types of providers such as physical therapists and rehabilitation.
Right, and I assume in those conversations or consultations with the patients, you talk about procedures. Some may be minimally invasive, others might be more intensive and risk factors. So at some point, I'm sure there's a conversation about kind of pain management and thresholds and just how that pain may impact kind of day to day.
Definitely, and a lot of this starts off with really listening to the patient, understanding what their goals of treatment are. I mean, if a patient is older and doesn't necessarily want to be that active, they may be less aggressive at treating their pain as someone that's younger that really wants to regain their full level of function. Yeah.
And some of the types of procedures in terms of surgeries. I mean, we've been over to the chamber, has been over to St. Vincent's as you've unveiled some kind of assistive technology. You're there with robots, kind of guiding and working together. I mean, I'm sure there's a lot of options for you to consider.
There are. I mean, pain medicine has seen a lot of advancements in technology, and every year there are new technologies that we can use to help treat people's pain. The sort of breadth of procedures really varies, and some of the more common procedures I do are procedures that are used to treat radicular pain. And radicular pain is pain that shoots down your arms or legs, and it's caused by pinched nerves. And what I do for that is I use image-guided epidural injections to really selectively and very precisely inject anti-inflammatory medications around those nerves. And that's sort of one of the most common procedures we do. Other procedures we do, which are a little bit more invasive, are things like radiofrequency ablations. And these are procedures that are used to deactivate the nerves that cause the pain in your low back or neck. And then, like you were saying, there's sort of a progressive advancement in terms of how invasive the procedures are. There are more advanced procedures such as spinal cord stimulation, peripheral nerve stimulation, and that are more surgical procedures that can be used as a more permanent solution when patients have more severe pathology.
And you mentioned some of those things kind of stemming from kind of pinched nerves. That's kind of your spine back.
Yes.
Yeah. Kind of the genesis of a lot of those.
it's obviously a very common pathology that patients have, and so I work very closely with primary care physicians, with surgeons, both orthopedic and neurosurgeons, as well as physical medicine and rehabilitation doctors, to treat these patients.
Right. We were kind of joking about the New England winters. As a result of that, are there falls and shoveling and doing things
There definitely are. I remember my first winter here was the winter of 2015 that we were talking about, and I saw so many patients with herniated discs and pinched nerves from shoveling that winter. That was the winter that we got a foot of snow every week, almost the entire winter. And so you see a lot more of these injuries occur from shoveling and improper mechanics when doing it, as well as through falls and other things like that as well.
Right. And I think your friends in cardiology sometimes too, because
they do.
That can be pretty stressful
it is.
As well.
Cardiac-wise, yeah.
Yeah. So in terms of the other element to this is you mentioned kind of medications. I'm sure through your training and ongoing kind of training, there's kind of been a whole kind of rethinking or revisiting of prescriptions and kind of how people approach that, given what we've learned with some of the issues around pharmaceuticals.
No, that's a great question. And so this, as everyone is well aware at this point, we're in the middle of an opiate crisis, and so the medications I use are not necessarily opiates, although not all opiates are bad. There is still a place for opiates. The place for opiates has changed, though. I think it's a lot less commonly used, and it's used as more of a salvage therapy at this point. After we've tried other less risky sorts of medications and procedures. I mean, over the last couple of decades, we've realized that the risk-benefit ratio of opiates is not necessarily what we thought it was when we started out. And so now we're much more selective in terms of who opiates are prescribed to, and we really try our best to minimize their use.
Right. So people shouldn't, it's fair for people to be kind of skeptical, ask questions, but generally speaking, kind of doctors, medical community like yourself are kind of rethink how you do that and handle that and prescribe.
Most definitely. I mean, we've learned a lot over the last couple of decades, and the role of opiates has evolved drastically compared to where we were, maybe 10, 15 years ago.
Right. One of the things we say that we're really lucky about here in Central Massachusetts, Worcester, Central Massachusetts, is that we've got some great hospitals, St. Vincent Hospital, UMass Memorial and their system. St. Vincent employs over 2,000 people, one of the largest taxpayers in the city of Worcester. Your experience, kind of 12 years just generally working at St. Vincent and in the community?
I've had a great experience working at St. Vincent's, actually. In fact, I came back to the Massachusetts area because I had the opportunity to rotate at St. Vincent's as a medical student. And I had a great experience, got to know some really great mentors here. And when the opportunity arose to come back, I jumped at it. And so my experience has been great. Obviously St. Vincent's has been through some rough times over the past few years, but I think we're
like a lot of healthcare.
A lot of healthcare has across the state, and I think we're headed in the right direction. I think it's a great place to get great care.
Yeah.
And we offer the same technologies as the hospitals in Boston, much closer to home in a community setting. Yeah.
Well, family members, have been there, had great experience at St. Vincent, and like I said, not only having first class care, but a major employer and taxpayer in the city, which means a lot. Dr. Prashant Kumar, pain management physician from St. Vincent, thanks for being with us.
Yeah, thank you for having me.
Yeah, and we're going to come right back for our next segment. Stay with us.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.